We and the French have been talking way back from March 2010, since the French found that this manufacturer was using the wrong filler for these implants. We've done tests in this country which were published in September of last year. The French did tests demonstrating that there wasn't a toxicity problem with these implants. I think we've agreed that there is no link with cancer, no evidence of a link with cancer. However, I talked to the French health minister yesterday. He is basing his precautionary approach on the fact that they have identified a higher rupture rate in France than in other countries, higher than we've identified in this country from reporting here, higher than in Australia or in Denmark. So to that extent, we are in a position where we have not identified safety concerns. To recommend that thousands of women should have an operation, including anaesthesia and so on, does entail a risk, and we don't want to recommend going down a path of many operations in circumstances where we don't have a safety concern that justifies it. Now, that is not to say that there may not be individual women who have concerns, maybe have symptoms, maybe have a failure of these implants. That would be different circumstances. That is why, if women do have their particular concerns about their circumstances, they really should talk to their consultant or surgeon about this. The issue is simply in relation to rupture rates, where the evidence is different in France. Now, in a sense, you can't say, well, which is right and which is wrong. There are two sets of information that have come through two systems. We don't know why that has happened. It's not possible to say that one is right and wrong. They both may be true, but they may have happened for reasons we haven't identified. So what we need to do is look at the information from France. Xavier, my colleague in France, was very straightforward that he will provide us with that information, but we haven't yet seen all the data and the analysis that goes with it in order to be able to find out why the French have got information that is in contrast to that in this country, Australia and other countries.